Hey everyone, I'm Svetlana with Incredible Marketing, and I'm here with Dr. Eisemann from Houston, H-Town.
H-Town, thank you.
We are in Orlando at the ASPS 2017 conference, and are you excited to be here?
Yes, very much. It's
Okay.
Very interesting.
Have you been to a couple of the conference lectures lately?
I have been to several of them, beginning
Okay.
at 7 o'clock.
Wow, okay. Did you go to the event last night? The crazy
I did part
Epcot event?
Part of the time.
So you were out late, but you still managed to wake up this morning
we
to
had
go to the
dinner
7 a.m.
beforehand. We had
lecture?
dinner beforehand.
Wonderful. What were some of the lectures that you listened to that you found interesting?
Well, the reason why I'm here, and also the lectures I found interesting, was on transgender surgery.
Okay.
Because I'm doing a fair amount of transgender surgery with facial feminization.
FFS.
Specifically, yes.
Correct.
And I have been trained in craniofacial surgery, but not aesthetic craniofacial surgery. And this is facial feminization, which I ding a lot of, but we're considering doing bottom surgery too, because these patients really don't have any place in Houston to do that. So we're very interested, and it's very active, and it's, of course, a very popular subject now. And I've been giving some lectures at the medical school now, which is very interesting.
You are? Which medical school?
Well, I'm involved with the Baylor College of Medicine, but I actually did one at the University of Texas. And it was very interesting. The students were the ones who requested this lecture because it's not part of their curriculum. And it's actually not even part of the curriculum in surgery either. It's sort of a meld of urology, gynecology, and plastic surgery. And but it does require special expertise from plastic surgeons.
Wow, so the residents specifically were asking
these
for
were
this. The medical students.
These were actually medical
so
students.
do you foresee that ever being added into the course load, into the training?
I'm sure it will be.
Next 5 years? or
Within earlier than that even.
Excellent.
Once we start getting involved in the subject, it's really...
You need to cater to all types of patients.
It's remarkable how the interest in the younger patients are, and actually this is a group that's been basically underserved, basically, and discriminated against, and even doctors themselves have had a tendency to kind of shy away from these patients for whatever reason.
And you're welcoming them into your practice, which is excellent.
Yeah, it's been fun.
Okay, and are there a couple of lectures here at the conference?
There's a number of lectures. There's a actually dissection course that they had on facial feminization. There are several courses about bottom surgery, but they're not dissection courses.
Okay.
But I think there are 3 or 4 actually.
Excellent.
And so there's some well-known people here who are doing the surgery themselves.
And you're hoping to bring some of that back into the practice as well.
For sure.
Okay, wonderful, wonderful. Well, let's get to know you also on a personal level. So I'm going to ask you a couple questions. Why did you get into plastic surgery?
I got involved in plastic surgery. I was also an otolaryngologist, ear, nose, and throat doctor before I even thought about plastic surgery. And I had a patient who lost their nose. He tried to commit suicide. He lost his nose completely, and he was really, really very disturbed psychologically. And after the surgery, which we did to reconstruct the nose, he became a different person. It was truly psychosurgery. I mean, it was just remarkable, the change in this individual.
It oftentimes is.
And
it really is.
I've seen it in my practice many, many times since, not necessarily to that extreme degree, but it happens in children too. It's really remarkable, very powerful specialty, and it's fun. It's operating from head to toe, from inside to outside, body, soft tissue, bone, everything, all the organs.
I love it. So, what were you like in high school?
I knew I was going to be a doctor.
You did?
My father was a doctor.
Okay.
And I didn't really know anything else.
Okay.
Honestly.
And he expected you to be a doctor?
Not at all. I have 2. I have another brother he's an airline pilot.
Okay.
So, never thought anything else. Other than that. So it was, and I've enjoyed it. It's great. I saw what he did, and I didn't think there could be anything else.
And what was your father's specialty?
He was a general practitioner, and he was also a radiologist.
Oh, wow.
But I thought I'd like to do something other than surgery, and tried very hard to get interested in all the other fields in medicine. In fact, took very little surgery in medical school, but I realized I couldn't. This wasn't me.
So you customize it to what you wanted to do.
You got to be what you got to be.
Agreed. Now, what's your favorite part of the job then?
What I'm doing that day.
What you're doing that day, whatever it is.
Whatever it is. People say, what's your favorite thing to do? And that's exactly what I tell them, what I'm doing that day.
That's a very optimistic way of looking at it as well.
It's fun. It's
good.
True. It's true. In fact, I have a son who's a plastic surgeon finishing his residency now. and he'll be
So
taking it
3
for
generations,
3
of
generations.
docs.
Yeah,
Wow.
I'm working on my grandkids too.
There you go. Excellent, excellent. Now, where's your son in school now?
He's finishing his residency.
His
at Baylor.
residency?
Yeah, he'll be finished this year, and
Good.
he's taking a fellowship in craniofacial surgery.
So then, did he take any of your classes when you were
I
lecturing?
operate with him now.
Wow.
In fact, I'm operating with him.
Is that
this week.
surreal a little bit? Like thinking like I raised this kid from diapers and now he's sitting
Well,
next to me
but it's
operating.
I don't think of him like I think of him like any other resident.
Wow.
And but it's
No
kinda,
special treatment then?
No, he's kind of recharged my interest too. You know, it's kind of interesting, and you think, well, after a while it gets old, but you know, the operating with the residents is great. It's fun.
I love it. I love it. Now, what's one thing that your patients don't know about you?
Wow. I think it's interesting with the internet, they really get to know you. They really do, even before they meet you. I mean,
Like this video, we'll get to know even more about you.
It's really remarkable, they do, because your whole bio is there, all your publications are there, what you do, what you don't do, social media is involved. I mean, they come to the office well prepared. I really
Smart.
do.
Yeah,
really
they do their homework.
Yeah, they do.
They're
It's
much more
as they've
educated
ever
now.
been.
If you could be any animal, what would you be?
Wow. I would be a rabbit.
And why then? A rabbit.
They're very cute.
Oh, I love it. That's great. Okay, you'd be a rabbit.
Yeah.
Thank you so much, Dr.
Thanks for
Eisemann.
you.
I really appreciate your
Good.
time. Thank
And,
you.
good luck with yours.
Thank you.